adult trauma and coping mechanisms, effective therapies and strategies for recovery. Adults who experience trauma face unique challenges in coping and recovery. Understanding these challenges and identifying effective coping mechanisms and therapies can support adults in their journey towards healing. This video examines the unique challenges adults face when dealing with trauma and discusses coping mechanisms and therapies that are particularly effective for adults. Challenges faced by adults with trauma, compounded stressors. Adults often juggle multiple responsibilities, including work, family, and social obligations. Trauma can compound these stressors, making it difficult to manage daily life and increasing the risk of burnout and mental health issues. The demands of adulthood can exacerbate trauma symptoms and hinder recovery. Chronic symptoms. Adults may experience chronic trauma symptoms such as anxiety, depression, and PTSD. These symptoms can persist for years and impact overall well-being and quality of life. Chronic symptoms can interfere with daily functioning, relationships, and overall health. Coping with past trauma. Many adults have experienced multiple traumatic events over their lifetime. Coping with past traumas while managing current stressors can be overwhelming and challenging. The cumulative effect of multiple traumas can complicate the healing process and require comprehensive therapeutic approaches. Social and professional impact. Trauma can affect social relationships and professional life. Adults may struggle with trust, communication, and maintaining healthy relationships, as well as experience difficulties in their careers. The impact of trauma on interpersonal and professional domains can lead to social isolation and career disruptions. Effective coping mechanisms for adults. Mindfulness and meditation. Mindfulness practices such as meditation can help adults manage stress, reduce anxiety, and improve emotional regulation. Regular mindfulness practice can promote relaxation and enhance overall well-being. Techniques such as mindful breathing, body scans, and loving-kindness meditation can support emotional healing. Physical activity. Engaging in regular physical activity, such as walking, running, or yoga, can reduce stress, improve mood, and support overall mental health. Exercise releases endorphins, which are natural mood elevators. Incorporating physical activity into daily routines can enhance physical and emotional resilience. Journaling. Writing about traumatic experiences can help adults process their emotions and gain insights into their feelings. Journaling can be a therapeutic tool for reflecting on experiences and promoting emotional healing. Keeping a journal can provide a safe space for exploring thoughts and emotions related to trauma. Social support. Building a strong support network of friends, family, and support groups can provide emotional support and reduce feelings of isolation. Sharing experiences with others who understand can promote healing and resilience. Engaging in social activities and seeking support from trusted individuals can foster a sense of connection and belonging. Effective therapies for adults. Cognitive behavioral therapy, CBT. CBT is a widely used therapy for adults with trauma. It helps individuals identify and challenge negative thought patterns and behaviors, develop healthy coping skills, and improve emotional regulation. CBT's structured approach provides practical strategies for addressing trauma-related symptoms. Eye movement desensitization and reprocessing. EMDR. EMDR is an effective therapy for processing traumatic memories and reducing the emotional intensity of trauma-related symptoms. It involves guided eye movements to help individuals reprocess traumatic experiences. EMDR can facilitate the integration of traumatic memories and promote emotional healing. Trauma-focused therapy. Trauma-focused therapies, such as trauma-focused cognitive behavioral therapy, TFCBT, and prolonged exposure therapy, PE, are specifically designed to address trauma-related symptoms and promote healing. These therapies provide targeted interventions to help individuals confront and process traumatic memories. Somatic therapies. Somatic therapies, such as somatic experiencing and sensoromotor psychotherapy, focus on the connection between the mind and body. These therapies help individuals release stored trauma and regulate their nervous system. Somatic approaches can enhance body awareness and support the resolution of trauma-related physical and emotional symptoms. Studies on adult trauma. Long-term effects of trauma. Research highlighted in GradCoach has shown that trauma can have long-term effects on mental and physical health. Studies have found that adults with a history of trauma are at higher risk for chronic health conditions, such as heart disease, diabetes, and autoimmune disorders. Understanding the long-term impact of trauma can inform comprehensive treatment plans. Effectiveness of therapies. Studies published in GradCoach have demonstrated the effectiveness of various therapies, such as CBT, EMDR, and somatic therapies, in reducing trauma symptoms and improving overall well-being. These studies highlight the importance of tailored therapeutic interventions for adult trauma survivors. Evidence-based therapies can provide effective solutions for managing and recovering from trauma. Case studies. Case studies provide insights into the experiences of adults with trauma and the benefits of targeted interventions. One case involves an adult who experienced childhood abuse and struggled with chronic PTSD. Through EMDR and somatic experiencing, the individual was able to process traumatic memories and improve emotional regulation. Another case highlights an adult who faced a traumatic accident and benefited from CBT and mindfulness practices, leading to reduced anxiety and enhanced coping skills. Adults face unique challenges when dealing with trauma, including compounded stressors, chronic symptoms, and the impact on social and professional life. Understanding these challenges and identifying effective coping mechanisms and therapies can support adults in their journey towards healing. By utilizing coping mechanisms such as mindfulness, physical activity, journaling, and social support, and engaging in therapies like CBT, EMDR, trauma-focused therapy, and somatic therapies, adults can navigate the complexities of trauma and work towards recovery. Ongoing research and awareness are essential for improving outcomes for adult trauma survivors and promoting long-term resilience and well-being. Addressing adult trauma with a comprehensive, multifaceted approach can support holistic healing and personal growth.